Good evening and welcome to the COVID-19 pandemic update. I'm Kayodo Kikulu. First, the highlights. There will be no Salah traditional Durbar in Katsina State for the second year running as concerns mount over the possibility of a third wave of COVID-19. Well, some good news for residents of Ekiti State as government takes delivery of second batch of 40,000 doses of AstraZeneca vaccines for the state. And EU declines renewing orders for AstraZeneca vaccines contract. Well, Nigeria is not alone in this decline in daily COVID-19 cases. Majority of countries, even those that were hard hit in the Americas and Europe, are experiencing a similar trend. But then, we've been here before. Recall last year, after a reduction in cases, a lot of countries relaxed public health and social measures too quickly. We also saw individuals let down their guards, only for those hard-won gains to be lost monumentally. Well, just moments ago, the WHO had a briefing, and this was the exact concern of the Director General, Dr. Tedros Ghebreyesus. And his message was to leaders, asking them to use every tool at their disposal to drive COVID-19 transmission down. But this is a time to surge your capacities, he says, even if your country has a downward trend. Well, speaking of trend, here's an insight into Nigeria's COVID-19 journey so far.
COVID-19 pandemic is not over yet, and that's the message of the Nigeria Center for Disease Control, advising Nigerians to ensure strict adherence to non-pharmaceutical interventions to curb the spread of the disease. The single-day count of COVID-19 infections in Nigeria remains relatively low, as 37 new cases from 6 states and the FCT have been confirmed, an increase from the 30 infections reported in the previous 24-hour cycle. The Yobe State had the highest figure of 13 confirmed cases. Lagos, the epicenter of the disease, recorded 12 cases, while Akwa Ibom had a record of 6 cases. 3 cases were reported in the FCT, while Edo, Kaduna, and Ogun recorded 1 case each. The latest tally raises the total number of confirmed cases in the country to 165,419. The fatality toll in the country still stands at 2,065 after the country recorded 0 death in the NCD's latest report, as it was in the previous 24-hour cycle. 47 people have been discharged after testing negative for the virus, bringing the total number of discharged cases to 156,297. The latest update by the National Primary Healthcare Development Agency shows that 82.8% of Nigeria's target population have now received the first dose of the Oxford AstraZeneca vaccine. According to the agency, Zamfara State, which has reached 101% of its target population, has now vaccinated more than half of its eligible population, with Kwara and Enugu following closely behind. According to Johns Hopkins Coronavirus Resource Center, there are now over 158 million confirmed cases and more than 3.2 million deaths reported across several countries in the world. Recently, Nigeria banned travels from Brazil, India, and Turkey to ensure that there are no imported cases from countries experiencing a surge in COVID-19 cases. The NCDC has announced a 72-hour validity period of the pre-boarding COVID-19 PCR test for all Nigeria-bound international travelers before their departure.
For the second year in a row, the Emir of Katsina, Abdulmumin Usman, has cancelled the Salah Durbar traditional festival for the forthcoming Eid al-Kabir Salah celebration, partly to reduce the spread of COVID-19. In a press release obtained by Channels Television, the Emir had, after a wide consultation with the government, healthcare and security agencies, as well as the Emirate Council, resolved not to hold the tradition, including other festivities, throughout the period. This is as most faithful across the country today observed the 28th day of fast, hoping to observe Salah on either Wednesday or Thursday. And over to Ekiti State, where the government has taken delivery of the second batch of the Oxford AstraZeneca COVID-19 vaccines. But that is not stopping the government's disease preventive efforts through training of health workers and general enlightenment. Our correspondent, Babajide Agbeyo, has more on these latest developments.
Ekiti State government has taken delivery of another batch of the Oxford AstraZeneca vaccine. 40,000 doses are in this fresh consignment, and it is expected to cater for the balance of frontline workers and other residents of the state who present themselves for vaccination. But the state is not stopping at this. Other efforts are being put in place to put the pandemic under check and to ensure that other diseases do not spread across the state. To this end, the State Ministry of Health and even the Ministry of Public Utilities have been going around to establish hand-washing points in public schools, coupled with training and retraining of frontline health workers on hand-washing and other hygiene rules.
We continue to build the capacity of healthcare workers and provide necessary infrastructure that will ensure the sustainability of hand hygiene practices in all health facilities. I therefore appeal to all of us to ensure regular performance of hand hygiene as a matter of personal responsibility.
The response of residents to the vaccination exercise in the coming days will give a better assessment of the disposition of the populace around here. Babajide Agbeyo for COVID-19 update.
So clearly there's a lot of activity around vaccination in Nigeria, but then there's a bigger conversation around the world on the production of this silver bullet, so to speak. Well, the head of the World Trade Organization, Dr. Ngozi Okonjo-Iweala, is asking for a pragmatic solution to addressing vaccine inequalities. And just a few days ago, the President of the United States, Joe Biden, called for vaccine patent waivers as a possible solution. The South African president is on his side, by the way, but the German government and pharmaceuticals are not in support, as they believe it might stifle innovation and even reduce the quality of the vaccine. So while that conversation is ongoing, you may wonder, just where does Nigeria come in all of this? This evening, we're joined virtually by Professor Oyewale Tomori to get a sense of where we are as a nation. He's a professor of virology. Good evening, Prof. Thank you for joining us on the program. So let's bring this vaccine patent waiver debate home. How can Nigeria come into this conversation?
Well, for now, good evening. I think for now, we are spectators. We're looking from the sideline. We don't produce, we're begging, we're asking for, we're seeking for donation. I know recently the government said they put out some amount of money to buy the vaccines, but then we have to line up for those who have already paid for the vaccine. So, you know, like I said, we're spectators on the sideline watching where the game goes.
Clearly, it's not enough to be a spectator in this fight against COVID-19. And I recall, and I'm sure you do also, that the Central Bank of Nigeria came up with the Healthcare Sector Research and Development Intervention Grant Scheme. And this was to basically boost domestic manufacturing of critical drugs and vaccines. Now, over 200 million has been given, according to reports from the CBN, to 5 researchers. 286 submissions were made. So do you see those research and development initiatives as Nigeria maybe getting into the field of play?
Yeah, I mean, it's a step in the right direction. But the 5 people that were given the grants, I'm not too sure there's any of them working on vaccine. They're working on other related drugs and things. So as far as vaccine is concerned, I'm not too sure of the grants that they gave address that. But I must say that between the central bank and the bulk vaccine, there's an approach, or there's a plan, series of meetings have started between the bulk vaccine Nigeria Limited and the central bank. And I'm sure momentum will move on after the holidays. And there's a great hope that we'll be able to get some support from the central bank on that line of vaccine production.
So if we're planning to move into this field, I mean, you say you don't exactly think that this might help us be in the field actively, but what are those specifics we can do? I know this might take years, clearly, but at least it's better late than never. So if we were to start today, what will those specifics be?
I think actually we started even before today. The bio vaccine has been moving and making arrangements with partners. You need to have the infrastructure in place. You need to have people who are trained, who will be able to carry out all those facilities, so that when you produce a vaccine, you have people who have the proper training, you have the transfer of technology, you have the infrastructures and the buildings put in place. All those will take time, but action is going on right now. As I said, with the bio vaccine, connecting with partners outside, signing agreement with some partners on those little stages that are going on. And so plans are in place. I think with the support which we are hoping to come from the central bank, we can move forward as quickly as possible.
So if you could just break this down for us, because there's been a lot of debate, especially for professionals in that field, about the vaccine waivers, intellectual property waiver. What will that entail really? I mean, take, for example, an AstraZeneca or Pfizer. If these talks were to, go through and then eventually there's an agreement on those waivers, how would countries participate, especially African countries like Nigeria?
The vaccine waiver is just one step. There are 2 or 3 other steps. There's what I also call the transfer of technology. And then you must have the infrastructure already in place. And so even if the WHO and others accept about the waiver, we still have other steps to go along with. And that was one of the things I was trying to explain, that it will require people trained in that technique. I mean, the messenger RNA technique is different from the regular vaccine that we're doing. So you need to train people. Well, I mean, and that could take some time. And that's what we call the transfer of technology. Secondly, you must have the place to do the manufacturing, even if you train the people. And many African countries don't have that in place already. So we're looking at the process of building infrastructures, training people, and then having the funds to carry out all of these activities. So I think we're still a little bit far away from the waiver of the patent. Is not, it's a first step in the right direction, but it's not that we start producing vaccine in the next 1 or 2 years, except you have those things already in place. And that's what happened. For example, the AstraZeneca with the Serum Institute of India, they already have the facilities. And so it was easy to sign an agreement, and they start producing immediately. But it took years for Serum Institute to have those infrastructures. So if you don't have it already, and you don't have the trained people, we are looking at another 3-4 years, even with the waiver of the patent, before you can get anything done.
Well, Professor Oyewale Tomari, always a pleasure to speak with you on this topic. Thank you for joining us.
Thank you, my friend. A pleasure.
Well, the federal government of Nigeria says it is partnering the ICPC and the EFCC to curb sharp practices in the ongoing COVID-19 vaccination drive in the country. The executive director of the National Primary Healthcare Development Agency, Dr. Faizo Shoaib, notes that the partnership, in addition with ongoing town hall meetings to sensitize citizens about the need to get vaccinated, will go a long way to curb the spread of the virus. Nigeria has so far vaccinated 1.6 million people since the rollout of the AstraZeneca vaccine in March this year.
In furtherance of our sensitization and mobilization efforts for successful COVID-19 vaccination campaign, NPHCDA, in collaboration with the Presidential Steering Committee, the National Orientation Agency, development partners, and other stakeholders, is conducting town hall meetings in all 6 geopolitical zones to address public concerns and hesitancy on the COVID-19 vaccine and vaccination in general. We have so far successfully staged the North Central Zonal Town Hall meeting in Lafia, which was hosted by the Nasarawa State government. The event is scheduled to be replicated in the remaining zones in the weeks ahead. To further strengthen vaccine security and accountability, we are deepening our collaboration with the Independent Corrupt Practices and Other Related Offenses Commission, ICPC, and the Economic and Financial Crimes Commission, EFCC. Our partnership in this regard is also aimed at further curbing cases of vaccine mismanagement and other anticipated sharp practices at the vaccination sites.
Now let's give you some updates from across the states on the vaccination campaign. We begin in Jos, the Plateau State capital, where vaccination of pilgrims for both the Muslim and Christian pilgrimages is ongoing. All those who have been enlisted for the pilgrimage must obtain their vaccination to qualify. Now, while all the successfully vaccinated Muslims will be airlifted for the exercise in July, the Christian pilgrims will leave on May the 29th. Meanwhile, 44,000 residents have received the first dose of the vaccine in the state. Now, according to the Executive Secretary of the State Primary Health Care Board, Dr. Livinus Miapwak, the first phase of the vaccination exercise ended on May the 8th, and plans are underway to commence the second phase of the vaccination exercise in July. And over to Ebonyi State, where there seems to be some hitches in the vaccination process. Although a few are still being vaccinated at the primary health care centers, the turnout is largely not impressive because of the security situation in the state. The major roads are barricaded between 6 p.m. and 6 a.m. and the increase in the police and military presence has largely affected the turnout of people for the vaccination against COVID-19. Well, in a matter of weeks, Bayelsa State will commence the second phase of the vaccination exercise. Those who have received the first jab of the vaccine say they are now waiting on authorities to receive their second dose. While 44,000 doses of vaccines were received in the state, about 15,000 people have been vaccinated so far. And here in Lagos, the Commissioner for Health, Professor Akiabayemi, has been given updates on the vaccination in the state. Well, outside Nigeria, Dr. Moni Gasper is a general practitioner, and she joins us from the UK to give us some insight into some of the trends we've seen in the UK and the EU at large. It's great to have you on the program. Let's begin with, the latest. British Prime Minister Boris Johnson has set out the next phase of lockdown easing in England, given the green light on gatherings and majority of sectors like museums, restaurants, playing areas, saying they can open from next Monday. Is this the beginning of the end for the pandemic era for you?
Thank you very much, and thank you for having me on your show. We're excited, we're absolutely delighted that this is happening, and we're all looking forward to the 17th of May, when we're going into the phase 3 of the lockdown being released. The Prime Minister has approached this in a very careful and very cautious manner because we want to do everything possible not to go back to where we've come from. Is it the end of the pandemic? At the moment, unfortunately not, because we're not safe till the whole world is safe. So we still have to take all the relevant public health measures that we've been advised to do from the beginning of this pandemic, even more so that we don't go back to lockdown, which is a very lonely experience for so many people. So unfortunately not, it's not the end of the pandemic.
You know, the tricky part is hugging and some level of closer contact will be allowed, except, of course, you're not meeting with friends as well. But the Prime Minister is also asking people not to throw caution to the wind, basically saying it's in your hands now. How well do you think people can handle this freedom, as you've said, after months of restrictions?
We need to protect the gains we've made, and we have made a lot of gains in the UK. We need to exercise caution, and we need to exercise common sense, most importantly. But we're very excited that we can visit our loved ones, we can meet indoors, and we can actually hug one another. But that doesn't say that we should hug people who we know are vulnerable, because that just takes us backwards in this pandemic. We see what's happening in India. We know the different variants are still around, and we now have the Indian variants in parts of the UK. So we're still being very careful. We cannot afford to throw away our gains.
So I'm just wondering, how are health workers like yourself preparing for a possible surge? Are there any special preparations, maybe a drill regarding what might happen if this goes south?
Some of us, my colleagues and I, have worked in COVID facilities from the onset of the pandemic, and systems are in place. We have all the frameworks in place. So there's really not very much to prepare for anymore. We're still following the guidelines that we know. We're looking at the science for guidance, and that's what we're following strictly. So I think we're in a good place. In fact, I think we're probably well ahead of the game. And the Prime Minister, having a very cautious approach to it, is hopefully to try to minimize the possibility of going back and having subsequent surges. Obviously, we can't predict it because the whole world hasn't been fully vaccinated yet. But as far as the UK is concerned, in terms of manpower and resources, I think we're on track for that.
Now, speaking of looking at the science, the Joint Committee on Vaccination and Immunization's decision to give under 40s an alternative to the AstraZeneca vaccine might, be in that line of looking at the science, especially as it relates to incidents of blood clots and all that. What's the implication of that on the vaccination drive?
Absolutely none. Absolutely none. We have enough vaccines in the country to vaccinate all the people that need to be vaccinated. The idea of offering an alternative vaccine to under 30s and under 40s is to exercise utmost caution, much more than a safety problem. We know that the AstraZeneca vaccine is very effective. We know that the endpoints have all been achieved in terms of serious illness and hospitalization and deaths. But because of the very rare side effects that happened with the AstraZeneca vaccine, with the cerebral venous sinus thrombosis, which is blood clots in the brain, in a very paradoxical manner, because the platelet counts, which we expect to be very high, are actually the opposite and very low. So with that, the numbers of people who have this some very extremely rare side effect are very, very few. So it's really just a precautionary measure. And anybody who's already had the first dose of the AstraZeneca is being advised to go ahead and have the second dose. And if they haven't got any of the at-risk factors for this rare condition, then we are still happy to give them the second dose. The best vaccine is the vaccine in the arm, not the vaccine that you're hoping to get in a few weeks or a few months' time.
Well, Dr. Monique Gaspar, thank you so much for taking time out of your schedule to speak with us on this topic.
My pleasure. Thank you very much.
Well, we have breaking news for you from right here in Nigeria. And effective from midnight Tuesday, phase 4 of the COVID-19 lockdown takes effect. Mass gathering in a public space restricted to 50 persons, access to government institutions denied to anyone without face mask, and government meetings and travels limited to virtual platform. Bars and nightclubs should remain closed. Nationwide curfew takes effect from midnight today till further notice. Only essential international travels are encouraged, and all existing protocols need to be adhered to. No limitation, however, to interstate travel. Again, breaking news, effective from midnight Tuesday, phase 4 of the COVID-19 lockdown takes effect, and you'll see mass gathering in public space restricted to 50 persons and access to government institutions denied to anyone without face mask. Well, that's the COVID-19 update for today. There's definitely more in the days ahead. I'll be here to give you all those details. But don't forget to protect yourself, because the virus is still out there. So continue to take responsibility and visit our website, channelstv.com, for more updates and better understanding of the pandemic. We also have all the big stories for you, from politics to business, sports, and so much more, all at your fingertips. Well, that's the COVID-19 update. Thank you for watching. I'm Kayode Okikiolu.